This program is rated PG. It contains themes and scenes which may not be suitable for very young audiences. Parental guidance is advised.
We're working to connect a region of over 600 cultural bridges between our lands.
Hello, you're watching Asean in Focus. We're coming to you live from Manila and Thailand. Hello, Gila.
Hello, Alma. Good afternoon. And I'm Gila Pablo from EBC Thailand Bureau, bringing you the latest news around the dynamic ASEAN region.
On today's headlines, dozens of Myanmar Security Force members were killed, rebel fighters said, after heavy fighting in the coup-hit country's eastern fringe.
The Philippines' COVID-19 recovery tally climbed to 94%, or 1,109,226, after health authorities reported 6,756 new survivors on Sunday.
Thailand will begin vaccine registrations for foreigners and expats on June 7. Our EBC Thailand Bureau's Cristel Di Marucot will give us an update.
An infectious diseases expert in the Philippines says ethnicity could be a contributing factor in the formation of rare blood clots among recipients of the United Kingdom-made AstraZeneca COVID-19 vaccine.
First, here in the country, the Philippines' COVID-19 recovery tally climbed to 94%, or 1,109,226, after health authorities reported 6,756 new survivors on Sunday. Now, this latest data from the Department of Health were from among the 1,179,812 who got infected since last year. The DOH also logged 3,083 new infections, bringing the total number of active cases to 50,635, or 4.3% of total cases. Of the active cases, about 93.1% are mild, 2.1% are asymptomatic, 2% are severe, 1.35% are moderate, and 1.5% are in critical condition. There were also 38 new deaths, pushing the death toll to 19,951, or 1.69% of total cases. Data submitted on May 21 likewise showed that 13% of 42,855 who were tested turned out positive for COVID-19.
President Rodrigo Duterte on Friday emphasized the importance to have greater global solidarity in order to defeat the coronavirus disease 2019, or COVID-19. Duterte made the call in his speech at the 26th Nikkei conference on the future of Asia. Malacanang said in a press statement, I quote, "First, we are only as strong as our weakest link as a country and as a region, and as one global community. This is why we need greater solidarity for collective, coordinated, and comprehensive responses. Inward-looking policies will lead us nowhere," Duterte, as quoted by the palace. Duterte, Malacanang said, assured participants in the Nikkei Forum that the Philippines supports all avenues for increased production of COVID-19 diagnostics, therapeutics, and vaccines. It thanked Japan and other partners in the Vaccines Global Access, or COVAX facility, a global initiative that guarantees access to COVID-19 vaccines worldwide. The COVAX facility, Duterte said, has benefited many developing countries, including the Philippines. And in Thailand, will begin vaccine registrations for foreigners and expats on June 7. Here's more from Cristel Di Marucot, our EBC Bangkok Thailand correspondent. Cristel?
Good afternoon, Gila. Here's the good news for the foreign nationals living here in Bangkok. According to a foreign ministry spokesman on Friday, all foreigners living in Thailand can begin registering at vaccination centers for a COVID-19 shot using their social security number or passport starting June 7. During the daily briefing of the Center for COVID-19 Situation Administration, Deputy Spokesman Natapanu Napakun said, and I quote, Thailand attaches utmost importance to vaccinating everyone according to their level of risk, regardless of nationality. We practice what we pledge. No one is safe until everyone is vaccinated. End of quote. The government had set June 7th as the start of the long-awaited mass vaccination program, and foreigners could register at designated hospitals or health centers where they live. This announcement follows confusion in foreign communities as it contradicts the Public Health Ministry's first statement last May 4 that priority would be given to vaccinating Thai people first. The decision was amended on May 6, giving equal access to the vaccine for both Thai and foreign nationals to help create herd immunity. Natapanu said that the actual vaccinations would depend on the appointment, wherein some may have walk-in shots available from June 7, while others may have to wait at a later date. Foreign nationals will begin the vaccinations at the same time as Thai nationals. Just over 1.7 million or 2.6% Gila out of more than 66 million people have received at least one dose of COVID-19 vaccine in Thailand. The government aims to vaccinate at least 50 million people or 70% of the population by the end of this year to achieve herd immunity. Back to you, Gila.
Thank you, Cristel, for your updates. Stay safe and be healthy.
Thank you, Gila. Stay safe and stay healthy. Reporting live from Bangkok, Thailand, this is Cristel Nicole Di Marucot. We live in interesting times.
And staying in Thailand, the Thai Department of Corrections starts vaccinating prisoners in Bangkok after nearly half of the 37,000 inmates tested returned positive results for coronavirus. The main vaccine used was the Sinovac, but some prisoners were to be given the AstraZeneca vaccine instead.
Meanwhile, Malaysia has again recorded its highest daily figure of COVID cases. Live joining us is Alfred Balmes from our Kuala Lumpur Bureau. Hello, Alfred. How is it over there in Malaysia?
Hi, Alma. 6,976. This is the highest figure ever recorded in Malaysia since the pandemic hit the country more than a year ago. Yes, you heard it right. 6,976 cases as of yesterday, according to the official tweet of Malaysian Health Director General Tan Sri Dr. Nur Hisham Abdullah. He also said the new cases involved 6,971 local transmissions, while 5 were imported, taking the number of active cases to 57,022. With the new development, the cumulative cases of COVID-19 in the country now stand at 512,091. 49 fatalities overnight, 681 cases in the intensive care unit, with 361 of them requiring respiratory support. 24 new cluster, and based on records, this cluster have already spread in multiple states in Malaysia. From these 24, 9 are from workplace cluster, recorded from the states of Kuala Lumpur, Johor, Selangor, Penang, Negeri Sembilan, Putrajaya, and Pahang. 8 are from the community cluster, recorded from the states of Negeri Sembilan, Johor, Sarawak, Terengganu, Sabah, and Kelantan. 6 are from religious cluster, recorded from the states of Pahang, Melaka, Kedah, Johor, Selangor, and Negeri Sembilan, and 1 high-risk group cluster, bringing the total number of active cluster to 556. Looking into the recorded cases from each state, the state of Selangor is still the highest number of new cases at 2,235. This was followed by the state of Sarawak with 663 and the state of Kelantan with 626. Back to you, Alma.
All right. Thank you very much, Alfred, and looking forward to more updates there in Malaysia. Stay safe.
Thank you. Live here reporting from Kuala Lumpur, Malaysia. This is Alfred Palmes. We live in interesting times.
No cases of black fungus have been identified in Maldives. Let's listen more from our EBC Maldives correspondent, Steffi Juan. Steffi?
Hello, Gila. Yes, Health Protection Agency confirmed that the Maldives does not have any cases of mucormycosis, or better known as black fungus disease. According to HPA, samples were collected and sent abroad to test for black fungus after symptoms close to the disease were identified from an individual in the Maldives. Results of the samples have now been received, which said that the symptoms from the patients were not of black fungus, but a fungal infection due to being bedridden for a long period of time. The samples were collected from an individual who had recently recovered from COVID-19, and the individual has been identified as an elderly person. The disease has been spreading in India with more than 9,000 cases confirmed, and so far the rare and deadly infection has caused concern in the public. Meanwhile, authorities in the Maldives have decided to introduce new measures and enhance the already in place measures taken to control the COVID-19. According to Mabruk Aziz, President Office spokesperson, new measures would come into effect on May 26. He also said that a lockdown has not been decided. He added that the new measures were not finalized and still being discussed. The announcement of new measures comes after the country undergoes the fourth wave of COVID-19 in the Maldives. But what does actually a black fungus means? Well, according to experts, it is caused by mold found in damp environments like soil or compost and can attack the respiratory tract. It is not contagious and does not spread from person to person. Several types of fungi can cause the disease according to the United States Centers of Disease Control and Prevention. These fungi aren't harmful to most people but can cause serious infections among those with weakened immune system. And that's my quick update from Maldives. Back to you, Gila.
Thank you so much for your update, Steffi. Stay safe and be healthy.
Thank you so much. Reporting live from Maldives. This is Steffi Juan, and we live in interesting times.
A new video released by the Ministry of Tourism seems to indicate that Cambodia is preparing to welcome back tourists in the fourth quarter of this year. A move designed to revive Cambodia's tourism industry hit hard by the pandemic. This move comes after figures for 2020 show that Cambodia suffered a tourism decline of around 80% compared to 2019, which has caused widespread job losses in the vital tourism sector. The video said that foreign tourists who have been vaccinated against COVID-19 will be exempted from quarantine or will have the quarantine period shortened. The video further added that the Ministry of Tourism is working with relevant authorities to ensure that Cambodia's tourist destinations are safe. Cambodia on Tuesday began COVID vaccination for Phnom Penh's general population as the country is speeding up inoculation drive amid infection surge and more people die from the virus. Cambodia plans to vaccinate at least 10 million of its 16 million population. Authorities have transformed schools and wedding party halls into COVID treatment centers as hospitals are running out of beds, and Prime Minister Hun Sen had earlier warned that the country was on the brink of death from the virus outbreak. Phnom Penh and adjacent city Tak Kamau were under lockdown for 3 weeks.
Dozens of Myanmar security force members were killed Sunday, rebel fighters said, after heavy fighting in the coup-hit country's eastern fringe. Myanmar has been in chaos since the February putsch, after the military uses assault force to crack down on it. The civilian death toll has climbed to at least 815 people, according to a local monitoring group. Violence first stung in the anti-junta movement to form a so-called People's Defense Force, or PDF, in their own townships, made up of civilians who fight back against security forces with homemade weapons. There were clashes in eastern Myanmar over the weekend, particularly in Phaya State's Demoso town and in neighboring Shan State. People's Defense Force member Ted Y, not his real name, said at least 20 police officers died Sunday, and his side seized a police station in Mohibel town, Shan State, east of the capital Nay Pyi Taw. The police station was burned down, and rebel fighters also took 4 security force members into custody.
Staying in Myanmar, the junta chief has said deposed civilian leader Aung San Suu Kyi is in good health and will appear in court within days during the general's first television interview since the coup. Min Aung Hlaing, who toppled Suu Kyi in a February 1 putsch, gave a 2-hour interview to Hong Kong's Phoenix Television on Thursday, with the full program yet to air. The general was speaking in Burmese, and his comments was translated into Chinese by the network. Asked about Suu Kyi's political achievements, the military leader said, in short, she has done everything she can. Suu Kyi has not been seen in public since she was placed under house arrest. She has been hit with a string of criminal charges, including flouting coronavirus restrictions during last year's election campaign and possessing unlicensed walkie-talkies. The most serious charge alleges that she violated the country's colonial-era Official Secrets Act. Suu Kyi is expected to appear in person in court today for the first time after weeks of delays to her legal case. Her legal team have faced an uphill battle to meet with their client in private.
A common library for orphans in Yangon, built out of recycled plastic waste, stands empty without books or readers. Another casualty of Myanmar's military coup. For many, environmental concerns have taken a backseat to the broader fight to regain democracy.
ဒီလိုကျွန်တော်ဆုံးဖြတ်ပစ္စည်းတွေကအမှိုက်မဟုတ်ဘူးဆိုတဲ့အကြောင်းကိုကျွန်တော်တို့အဓိကပြောကြလို့ဖြစ်တယ်ပေါ့နော်။ဘာကြောင့်လဲဆိုတော့ကိုကအသုံးမလို့ဆုံးဖြတ်လိုက်တဲ့ဆိုပေမဲ့တခြားတနေရာမှာပြန်လည်ပြီးအသုံးပြုလို့ရတယ်။အဲလိုမျိုး recycle လုပ်ခြင်းအပြင်ဒီဆုံးဖြတ်အမှိုက်တွေကရောကြလာမယ်။နောက်တစ်ခါကျတော့1လီတာ eco bit တစ်လုံးဖြစ်ဖို့ဆိုရင်အနည်းဆုံးတစ်နာရီအချိန်ပေးရပါတယ်။ကျွန်တော်တို့အခုတည်ဆောက်မဲ့အဆောက်အဦမှာဆိုရင် eco bit အလုံး9000ပေါင်းတယ်။အဲ့လိုကျွန်တော်နိုင်ပေါင်း9000ချိန်သားဝန်ထမ်းတွေကပေးဆက်ပြီးတော့ဆောင်ရွက်နေကြခြင်းဖြစ်တယ်ဒီနိုင်ပေါင်း9000စာ plastic တွေဒီထဲမှာရှိတယ်ပေါ့နော်အဲ့တော့ကျွန်တော်တို့ကဘာမျိုးကိုနိုင်ပေါင်း9000ကျွန်တော်တို့စောက်ရှောက်ပြီးသားဖြစ်တယ်ဆိုတော့အဓိကပြောကြလို့ပါ
ဘာမို့အကုန်လုံးပေါ့နော်ကျွန်တော်တို့နေရာထိုင်ရတာကကျွန်တော်တို့ဒီလွတ်လပ်မှုတွေမရှိတာတော့ကျွန်တော်တို့လောရအကုန်လုံးဒီတဖြည်းဖြည်းကြက်ကြတာလို့ပဲတခြားပေါ့နော်ကျွန်တော်တို့မှမဟုတ်ဘူးဒီအစအရာနိုင်ငံမှာနေဒီအကုန်လုံးကျွန်တော်ခက်ခဲလာကြုံတွေ့ရတယ်ခက်ခဲလာအဲ့ဒါတွေအကုန်လုံးကိုကျွန်တော်တို့တွေမှမဟုတ်ဘူးအကုန်လုံးပေါ့နော်ခံစားနေတဲ့အတိုင်းကျွန်တော်တို့တွေလည်းဒီခက်ခဲပြီးတော့ဒီဖွင့်ဖို့တွေနှောင့်နှေးလာတာတွေကျွန်တော်တို့ရဲ့ process တွေလုံးမဲ့ဟာတွေအကုန်လုံးလည်းအရာနဲ့ကြက်ကြလာပြီးတော့
The library had been expected to open this year, but Myanmar has been in turmoil and its economy paralyzed since civilian leader Aung San Suu Kyi was ousted from power on February 1. Still, the process of creating the library has been a valuable learning experience for the children at the orphanage. In Myanmar, discarded plastic bags and bottles often litter roadsides and clogged drains. According to one conservation group's survey, 119 tons of plastic waste enters the country's vital Ayeyarwady River every day, making it one of the most polluted waterways in the world. The eco-brick trend began in Guatemala in 2005 as villages there grappled with plastic waste and no official rubbish dumps or waste collection systems. The concept has since gone global. The charity is now building a third eco-brick school in Yangon's Lengtari Yard Township. It is expected to be finished in July and will have 3 classrooms to cater for up to 90 pupils. Unlike the eco-brick library with its exposed bottles, the charity renders the plastic bottles with concrete.
This portion is brought to you by Security Bank.
Humanda na kayo dahil this is gonna be an exciting battle para sa ating monthly finalist. This is Tagisan ng Galing Part 2 Singing Edition.
This program is supported by China Bank. Your success is our business.
Welcome back. Back here in the country, the Department of Health is now investigating the alleged illegal online selling of government-procured jabs in the cities of Mandaluyong and San Juan. During a Laging Handa briefing, Health Undersecretary Maria Rosario Vergere said all vaccines available in the country are using Emergency Use Authorization or EUA and cannot be sold commercially, more so because it is government-procured. Let's listen in.
At tayo po ay nakipag-ugnayan na sa ating mga local government officials. Sila rin po gumagawa ng kanilang investigasyon. And at the same time, ang DOH po together with DILG ay gumagawa na rin ng investigasyon. So antayin po natin kung ano makalap natin na resulta dito sa investigation. But definitely, kung yan po ay mapatunayang totoo, makita natin yung mga taong gumagawa nito, they will be penalized based on the sanctions that are provided in our existing laws.
A viral post had been circulating online showing that priority slots for vaccines are offered at a price by people with alleged connections with the local governments of Mandaluyong and San Juan. In separate statements, San Juan Mayor Francis Zamora and Mandaluyong Mayor Menchi Abalos confirmed that an investigation is being conducted in coordination with law enforcers regarding the report.
Dr. Annalisa Ong from the DOH Technical Advisory Group talks about what happens when delaying or deferring the second dose of the vaccine.
Karaniwan, ang epekto ng bakuna, mararamdaman natin yan makatapos ang 2 linggo. And particularly, kung 2 dosis dapat yung bakuna bago makumpleto, we can only expect yung quoted efficacy rate to start being felt 2 weeks after the second dose. Well, syempre kung hindi natin makumpleto yung takdang dosis, talagang hindi natin maaasahan yung kabuuan ng proteksyon na gusto sana nating asahan galing doon sa bakuna. And pero siguro yung assurance is kahit nakaligtaan mo yung schedule or hindi ka talaga makarating doon sa schedule na yon, kailangan lang na ihabol yung 2nd dosis para maabot mo pa rin yung proteksyon na inaasahan. Hindi na kailangan ulitin pa yung unang dose na natanggap. Well, syempre, we want people to come back as soon as possible. Pero hindi naman, wala namang actual dates, no? Ibig sabihin, hindi dahil naka3 linggo ka na, hindi na dapat ibigay yung second dose. We still give the second dose. So basically, the sooner you can come back after the missed schedule, pinakamaigi para mas maabot mo na kaagad yung proteksyon na dapat mo matanggap.
Cost of vaccines for priority groups will be shouldered by the Philippine government. The Philippines recorded its highest daily vaccination rate since the national vaccination program was rolled out in March, as 229,769 doses were administered on Thursday, breaking the previous high of 120,529 jabs on May 15.
Staying in the country, infectious diseases expert Dr. Annalisa Ong said on Saturday that ethnicity could be a contributing factor in the formation of rare blood clots among recipients of the UK-made AstraZeneca vaccine. Let's listen in.
Maaari, no? Kasi minsan nabanggit yan Bakit na lang hindi natin tanggapin yung rekomendasyon ng other regulatory authorities ng ibang bansa? Total, meron naman silang capacity and expertise. Ito na nga precisely yung reason. Kasi may mga effects na nakakonfine sa particular ethnic population. So tulad na lang nitong observation na to, it seems like marami sa Caucasian population. Sa ibang mga bansa sa Asia na gumagamit ng bakunang ito, parang wala rin tayong naririnig. Ano? So that's, good news for us, but we continue to monitor para siguradong wala talaga magiging problema.
European Union countries as well as Australia have issued warnings against Vaxzevria, a vaccine by AstraZeneca after the emergence of the VITT following its use. No case of VITT or vaccine-induced immune thrombotic thrombocytopenia has been reported in the Philippines so far. It is now termed thrombosis with thrombocytopenia, a syndrome or TTS by the U.S. Center for Disease Control and Prevention and Food and Drug Administration. Ong Lim, a member of the Department of Health Technical Advisory for COVID-19, said the Philippine Food and Drug Administration decided to resume the use of AstraZeneca vaccine in the country.
A study by Public Health England has found that both the Pfizer and AstraZeneca jabs are highly effective at protecting people from the strain of the COVID-19 virus first found in India. The analysis carried out between 5th of April and 16th of May found the Pfizer vaccine was 88% effective against symptomatic disease from the India variant 2 weeks after a second dose, compared with 93% effectiveness against the Kent strain. For its part, the AstraZeneca jab was 60% effective, compared with 66% against the Kent variant over the same period. According to a report from The Guardian, the difference in effectiveness between the two vaccines could be due to the rollout of second AstraZeneca doses taking place later than those for the Pfizer jab, according to the Public Health England on Saturday. Data suggests that it takes longer for the AstraZeneca jab to reach maximum effectiveness, so the protection it provides could increase further. It was also found that both vaccines were 33% effective against symptomatic disease caused by the India variant 3 weeks after the first dose. This compared with about 50% effectiveness against the Kent variant.
Meanwhile, medical workers conducted COVID-19 swab tests for students from primary school to high school at Vin School Private School in Hanoi, as Vietnam is trying to control the fresh wave of virus ahead of the National Assembly elections today. Take a look.
Đối với việc mà lấy mẫu xét nghiệm COVID của các bạn nhỏ từ tiểu học lên đến trung học thì rõ ràng là khó khăn hơn so với người lớn rất là nhiều. Tại vì với người lớn thì khi mình hướng dẫn, người lớn sẽ làm theo được. Và khi các bạn nhỏ thì mình hướng dẫn các bạn rất khó để làm theo, cộng với cả là các bạn nhỏ thì sẽ có nhiều nỗi sợ hãi hơn người lớn. Áp lực có, nhưng mà chúng tôi thấy cũng có rất là nhiều niềm vui khi mà tiếp xúc với các bạn nhỏ ấy. Thì cũng giúp cho mình thấy yêu đời hơn, thấy công việc này có nhiều ý nghĩa hơn rất là nhiều.
Em thấy nước mình chống dịch rất là tốt, và dù có dịch nhưng mà em vẫn được học ở nhà, thì em vẫn được học những kiến thức mà em cần thiết, nên em vẫn rất là vui ạ.
Several measures have already been deployed to curb the spread of the coronavirus in Vietnam, including lockdowns in districts with higher numbers of cases and limits on large gatherings. Schools in most localities across the country, including capital city Hanoi, have been closed and switched to online learning. People who have been in close contact with COVID-19 patients or entering Vietnam are being subjected to a 21-day mandatory quarantine. Some cities and provinces also require quarantine for people who come or return from pandemic areas in the country.
When the COVID-19 pandemic struck, Professor Gregory Gray at Duke University's Global Health Institute tasked a graduate student at his lab with developing a pan-species coronavirus test in order to help prevent the next catastrophe. The idea was to deploy the tool once its accuracy was validated, to look back at test samples from human patients in order to search for signs of coronaviruses that might have begun to cross over from animals. Gray and his colleagues' findings, released Thursday in Clinical Infectious Diseases, showed a canine coronavirus was present in a group of mostly children patients admitted to hospital for pneumonia in Malaysia in 2017 and 2018. The team suspects the dog virus caused their illness, as opposed to merely being present in the patient's airways, but can't conclusively prove it. Given the genetic makeup of the virus, it's unlikely that it is currently circulating between humans. Most scientists believe the SARS-CoV-2 virus that causes COVID also has a zoonotic origin.
Meanwhile, scientists at Thailand's Chulalongkorn University Veterinary Science School have been working with a team of labs and retrievers in recent months to train them to sniff out coronavirus cases. Take a look.
They didn't identify the virus. They are not PCR machine. So what they detect is the volatile organic compounds that produced from our body by cell metabolism of the infected organ. We have volunteers who donate their sweat for the study, and those were confirmed by PCR already that they were infected, and we did the doctor, the human doctor, delivered the samples to us, and gave to the dogs. The dog has its own capability that never been never been shown up before. And it's amazing for us to know that their nose, their receptors in the nose can help human patients to screen the pandemic disease like this.
Now, tests show that the animals have an accuracy rate of nearly 95% in detecting infected asymptomatic patients. It's understood the dogs will be used in addition to regular screen processes. The dogs will offer an alternative speedy method to testing for COVID-19, especially when it comes to screening bedridden patients.
International organizations have come together to launch a new One Health high-level expert panel to improve understanding of how diseases with their potential to trigger pandemics emerge and spread. The panel will advise 4 international organizations on the development of a long-term global plan of action to avert outbreaks of diseases like H5N1 avian influenza, MERS, Ebola, Zika, and possibly COVID-19. Let's watch the bits.
The COVID-19 pandemic is a powerful demonstration that human health does not exist in a vacuum, and nor can our efforts to protect and promote it. The close links between human, animal, and environmental health demand close collaboration, communication, and coordination between the relevant sectors. One Health is not a new concept, but the high-level expert panel is a much-needed initiative to take it to the next level.
So we need that One Health approach, but let's be honest, the weakest link in terms of our attention as a global community, in terms of our research and our investment in the animal-human environmental continuum is environmental health. And together we can fix that. That means ending overexploitation of wildlife and natural resources. That means having a conversation about global dietary patterns. That means farming that is nature positive. This means finance that doesn't destroy nature. And it means investing in the science and the partnerships across disciplines and capacities so that we're able to prepare and prevent the next pandemic.
The approach is the most important thing you have to do. So mostly
the panel will consider the impact of human activity on the environment and wildlife habitats. Critical areas will include food production and distribution, urbanization and infrastructure development, international travel and trade, activities that lead to biodiversity loss and climate change, and those that put increased pressure on the natural resource base, all of which can lead to the emergence of zoonotic diseases. The panel will guide development of a dynamic new research agenda and draw up evidence-based recommendations for global, regional, international, and local action.
Nine Britons have been banned from working in Singapore after breaking coronavirus rules by partying on a yacht in swimwear and Santa hats, according to reports last Thursday. Images of last year's Boxing Day festivities on the vessel went viral on social media, sparking fury from Singaporeans and prompting authorities to launch an investigation. At that time, gatherings outside the home were limited to only 5 people under curbs to prevent the spread of the virus. The Labor Ministry announced on Thursday that 8 Britons from the party, 5 men and 3 women, had been permanently banned from working in Singapore. Broadcaster CNA and newspaper The Straits Times reported this. Another British woman who took part in the festivities had already been banned in March from working in the city-state, which has a large foreign population. 8 of the Britons also pleaded guilty Thursday to exceeding the maximum limit on group sizes and were each fined 3,000 Singaporean dollars, according to reports. They could have been fined up to 10,000 Singaporean dollars or jailed for up to 6 months or both. The ministry didn't immediately respond to requests for confirmation. The city-state, which has had a relatively mild outbreak, reporting around 61,700 cases and 31 deaths, has taken a tough stand against violations of virus restrictions. In June last year, 4 British men were banned from working in Singapore after going on a pub crawl in a breach of curbs.
Alma and I will be back after this break.
Totoo ang kasabihang may pera sa basura, lalo na kung magagawa ang iba't ibang bagay mula sa mga recyclable material na inaakala ng iba na itatapon na. May ilang barangay sa bansa ang nagre-recycle ng basura at makikita ang iba't ibang bagay na gawa sa basura. Mga dekorasyon sa bahay, sa mga proyektong ito, nagiging malinis ang kapaligiran bukod sa mayroon pang pagkakakitaan.
Impormasyong mahalaga sa taong bayan. Patas na pagbabalita. Papakinggan ang magkabilang panig. Lilinawin ang mga issue at kaagad na ihahatid ng objektibo. Mata ng Agila. Tumadagit ng pinakasariwang pangyayari, hindi lamang sa loob ng bansa, kundi sa iba't ibang panig ng daigdig. Mula sa Eagle News teams at sa tulong ng makabagong teknolohiya, tiyak na makakalap kaagad ang katotohanan. Para sa mas matalas, malinaw at malalimang pagbabalita. Ito ang mas pinatalas na Mata ng Agila. Inihahatid ng veteranong broadcast journalist na si Eli Saludar. Kasama si Binibining Pilipinas Intercontinental 2019 Emma Tiglao. At pinangungunahan ng batikang mamamahayag ng bansa, Vic De Leon Lima. Mata ng Agila, Lunes hanggang Biyernes, alas 6 hanggang alas 8 ng gabi, dito sa Net 25.
Welcome back to Asean Focus. Meanwhile, Finance Secretary Carlos Dominguez III and New Zealand Ambassador to the Philippines Peter Kell have discussed possible bilateral cooperation arrangements that would allow the Bureau of Customs and Social Security System to tap New Zealand's expertise on modernizing their respective processes and services to better serve the public. Kell said during a recent virtual meeting with Dominguez that New Zealand can get involved in the ongoing BOC modernization project as a consultant and advisor. He added New Zealand can provide training and the services of its experts to assist the BOC in capacity building and modernizing its trade facilitation and border protection functions. New Zealand is also finalizing the financing component of a project with the SSS to redesign the processing of Social Security pensions and other benefits, which aims to improve the approval system and procedures for SSS members applying for these claims. Dominguez expressed his deep appreciation for New Zealand's offer of assistance and assured the ambassador of the support of the Department of Finance for both initiatives.
Meanwhile, the International Monetary Fund proposed a $50 billion plan to end the COVID pandemic with a target of vaccinating at least 40% of the world's population by the end of this year. IMF Chief Kristalina Georgieva presented the plan to world leaders at the G20 Global Health Summit in Rome that aims to have at least 60% of the world's population vaccinated by the end of 2022. Take a look.
By now, we all know there is no durable end to the economic crisis without an end to the health crisis. And that means pandemic policy is economic policy, highly relevant for the work of the IMF. And for this reason, we have published today a contribution to the ongoing debates on how to address the gap in vaccines, diagnostics, and therapeutics that many developing countries face. It has three broad elements at the estimated cost of $50 billion. First, vaccinating at least 40% of the global population by end 21 and at least 60% by the first half of 22. Second, ensuring against downside risks such as new variants that may necessitate booster shots. And that means investing in additional vaccine production capacity by 1 billion doses, diversifying production, scaling up genomic surveillance and supply chain surveillance, and contingency plans to handle virus mutations or supply shocks. And third, managing the interim period where vaccine supply is limited with widespread testing and tracing, therapeutic and public health measures, and at the same time, ramping up preparations for vaccine deployment together with any approved dose stretching strategies.
Asian market mostly fell Monday as inflation concerns play off against optimism over the global economic recovery, while spiking infections in parts of the region are also keeping investors on their toes. Wall Street provided a tepid lead at the end of last week, though European equities were given a boost by upbeat Eurozone economic data and progress in the bloc's vaccination drive after a slow start. With expectations that the global recovery will pick up pace this year, the main focus is now on the impact that will have on prices, with observers warning a long period of high inflation will force central banks to wind back the ultra-loose monetary policies that have helped fire a long-running market rally. In early trade, Hong Kong, Shanghai, Seoul, Wellington, Taipei, Manila, and Jakarta were all in negative territory. Tokyo, Sydney, and Singapore edged up.
Back here in the country, two suspected drug dealers were killed in a joint Philippine National Police, Philippine Drug Enforcement Agency or PNP-PDEA anti-illegal drugs operations, while some 10 kilograms of shabu worth 68 million pesos were seized in Muntinlupa City Sunday night. Take a look. Philippine National Police Chief General Guillermo Eleazar identified the slain suspects as Jordan Sabandal Abrigo and JV De Guzman. Seized were 3 plastic packs of Chinese tea bags containing an estimated 10 kilograms of suspected white crystalline shabu, 1 black Nissan Safiro without plate number, 2 loaded caliber .45 pistols, and marked money. Citing reports from PNP Drug Enforcement Group Director Brigadier General Remus Medina, Eleazar said the operation took place on Sunday evening in Katarungan Village 1. Now, during this operation, the suspects found found out they were dealing with law enforcers, prompting the firefight. No member of the law enforcement teams were hurt during the operation. In his report to Eleazar, Medina said the suspects were members of the Divina Gracia drug group, led by Michael Divina Gracia and a certain Johnson, a Chinese national currently serving sentence at the New Bilibid prison. The group is known to be drug distributors in different areas of the National Capital Region, Region 6, and other nearby provinces. The drug syndicate also operates in different areas of Visayas and Mindanao, using cargo trucks that travel via Roro from Batangas Port and received by their Muslim cohorts in the area, according to Eleazar.
After the pandemic torpedoed his chance to work at a Michelin-starred New York restaurant, Lim Wei Keat returned to his roots by becoming a Singaporean street food chef cooking local fare. The 25-year-old is among a small but growing number of young Singaporean street food vendors or hawkers, fueling hopes that a new generation will preserve the city-state's culinary traditions.
Local and traditional iconic dishes will be disappearing if younger people do not take over the store or learn these dishes.
我年龄大了，我的孩子不要接班，我不教，以后也在新加坡没有这个口味了。
Back in the day, it was really seen as a profession for those who have no route into life. So that has changed a lot today, but that perception hasn't gone. I think there's still a school of people who would say, "What? You want to be a hawker? What's wrong with you?"
I love chicken rice, so why not start with something that I love and I'm passionate about?
Thank you, Gila, for keeping me company today.
Thanks also, Alma, and good afternoon again. And that is the latest news in the Southeast Asian nations. I'm Gila Pablo, and we live in interesting times.
And we'll see you back tomorrow. I'm Alma Angeles. We live in interesting times.